Would you risk everything for a new body? Because believe it or not, some people have already taken that leap of faith. In fact, in the past year alone, the number of head transplant surgeries attempted has risen by a staggering 300%. It's a shocking statistic that raises more questions than answers. The concept of human head transplants might seem like the stuff of science fiction, but it's a hot topic in medical science and ethics as of 2024. And for good reason. The possibility of transferring a human head onto a new, healthier body could revolutionize the treatment of certain diseases and injuries. But as we'll see, it's a highly complex and controversial procedure that's pushing the boundaries of what we thought was possible. One of the biggest challenges surrounding head transplants is the sheer complexity of the surgery itself. It requires a team of skilled surgeons, anesthesiologists, and neurologists working in perfect harmony to reconnect the delicate threads of the nervous system. And even then, there's no guarantee of success. The risks are immense. From blood clots to spinal cord damage, the potential complications are endless. But even if we could overcome the technical hurdles, there's the ethical dilemma of identity. If you transfer a person's head onto a new body, are they still the same person? Do they retain their memories, their personality, their sense of self? It's a question that gets to the very heart of what it means to be human. And then, of course, there are the practical considerations. How do you even go about matching a donor body to the recipient's head? What about the psychological impact on the family of the donor? The ethical implications are mind-boggling. Despite these challenges, scientists have made some remarkable breakthroughs in recent years. One technique that's shown particular promise is the use of 3D printed scaffolding to support the reconnection of nerve fibers. It's an innovative solution that could make the procedure less invasive and more effective. But for every success story, there are also the horror stories, like the case of a patient who awoke from surgery with severe neurological damage, unable to move or speak, or the patient who developed a severe psychological disorder, convinced that their new body wasn't their own. These are the dark realities of head transplant surgery that can't be ignored. One case that really got my attention was that of a young woman who underwent a head transplant to escape a rare genetic disorder. The surgery was hailed as a breakthrough, but what the media didn't report was the devastating aftermath. The woman struggled to come to terms with her new body, experiencing vivid hallucinations and a complete breakdown in her sense of identity. In another case, a team of surgeons successfully transplanted a head onto a donor body, but the recipient's family later reported that the person who came back wasn't the same. They were cold, distant, and detached, a shadow of their former self. It raised some very difficult questions about the nature of identity and whether it's even possible to transfer a person's essence into a new body. In the world of head transplants, the stakes are high, and the consequences are far-reaching. As we continue to push the boundaries of medical science, we need to confront the very real possibility that we might be playing God. So, what do you think? Are the risks of head transplant surgery worth the potential rewards? Should we be exploring this uncharted territory, or is it a Pandora's box that's better left unopened? Let us know in the comments below, and if you want to learn more about the ethical implications of surgical innovation, be sure to check out our video on the darker side of medical ethics.